Did you know that we are lucky enough to have TMC Wound Care Center right here in our own backyard? Dr. Michael Lavor is here to tell us why we may need specialized care for wounds and what type of treatments the center actually offers. Doctor, thank you so much for coming in today.
Thank you.
So let's actually start out with that. Why would somebody need specialized care for a wound?
Someone who has a chronic wound that is not healing or appears to be getting worse, or they can't tell if there's an infection or something like that that's causing the wound not to heal, is a good idea to go see someone who specializes in multiple different types of wounds.
So then how does that specialized care actually help in that situation?
What we do is evaluate the patient, see if they have diabetic problems, if they have arterial problems, venous problems, and you evaluate the wound, and then you try and determine if there's a particular type of therapy that may be better, more beneficial for that wound, and then base everything based upon the patient and the wound.
Okay, and I think when we say wound, that kind of is a very big general umbrella, but what are maybe the most common wounds that we see?
Some of the most common are people that are diabetic that have foot wounds, and they've either stepped on something, have a neuropathy, don't know it, that they've had venous stasis disease and developed wounds in their legs, or traumatic wounds. Any kind of bites sometimes will turn into a non-healing wound, or even surgical wounds that are non-healing.
Now, is there a difference maybe in how wounds heal along the way?
There are. If everything is fine and the patient's normal and they don't smoke and they're not obese, they control their weight, they control their diabetes, they don't have peripheral vascular disease, then wounds tend to heal very well. But if you have one of those factors that can alter the healing time or even cause it to be detrimental as far as their healing.
And I did say right off the top that we're very lucky to have this center right here in our own backyard. So what are maybe some of the new treatments that we're seeing?
We have a lot of new treatments that are, some of them have been around for a while, like vacuum therapy, where you're putting suction on a wound. We also have hyperbaric treatment and hyperbaric oxygen therapy for particular types of wounds. The skin grafts or skin substitutes can be done, sometimes taking the patient to surgery once you get a wound almost healed or to a point where it'll accept a skin graft, we can do that. And some of the new stem cell therapy is also very promising.
Now, I know we're talking about the treatments that are available at the center and things that we can do, but since I have you here, doctor, is there anything that we can let people know they could do at home?
Actually taking very good care of the wound, number one, keeping it clean, keeping it moist. A lot of people think you go out in the sun, let a wound dry out, and it'll help it heal. In reality, that can sometimes be detrimental. Using peroxide in a wound, like your grandmother used to do, or betadine, is actually detrimental also. So keeping a wound clean and moist, and if you have a skin tear, which is very common, actually putting the skin back over the wound and putting a dress over it, a dressing over it, can actually prevent a major wound from developing.
And I know, we're talking about the different kinds of wounds and ones that aren't healing quite right, and that would be obviously a reason for us to come into the center. What about some common wounds that we can handle at home?
That would be some of the wounds that I talked about, such as skin tears, minor traumatic wounds where you just keep the wound clean, washing it well, keeping a moist dressing on it. Sometimes you have a hematoma from bumping your skin and have just a bruise. That's not a problem. But if you have a swelling of the hematoma, evaluating it, looking at it, and determining whether you can take care of it or whether you should go to an emergency room or a wound care center. But some of the minor wounds are very easy to take care of as long as you keep them moist and clean. Moist
and clean, that's a good rule of thumb. So now that we know kind of what we can handle at home, what of course we need to come into the center, how do we kind of access some of these services?
The patient's primary care physician really needs to have a referral to the wound care center, and that is arranged through the scheduling department at Tucson Medical Center. The wound care center, which I didn't mention earlier, has now been designated a center of distinction, which is an honor for, it's actually I think the only one in southern Arizona to receive that award. And so to get in, having your primary care send a referral, or if the patient actually has a question and they want to call up, they can also access our phone number, and then we can direct them to how to come in.
Well, first off, congratulations on that great honor,
Thank you.
As you were saying. And this is good information to know what the Specialized Center kind of handles, how we get that services, and what we can kind of handle at home and how we would do that. So we've covered so much today, Doctor. You've done a wonderful job. I want to thank you so much for coming in again.
Thank you very much.
Let's kind of wrap this all up for all of you at home. If you do have some information you're looking for, TMC Wound Care Center is located at 1400 North Wilmot Road. To learn more, call 324-4220 or visit tmcaz.com/wound-care.